Hello. Today we'll be talking about the respiratory system and its disorder. We'll be dealing with question 21 to question 40. The main function of the respiratory system is to inhale oxygen and to exhale carbon dioxide. Respiratory cycle are three number: inhale, exhale, pause. Inhalation, exhalation, and pause. That's the three respiratory cycle. And the respiratory system, they are made up of different organs, starting from the nose and the mouth. Because sometimes some people use their mouth to breathe, to inhale and to exhale, depending on different conditions. So the nose, the mouth, then you go to the pharynx. The pharynx is your throat. They have three types or three parts there. The upper part close to the nose is called nasopharynx. The middle part that is close to the mouth is called oropharynx. Then the one close to the larynx is called laryngopharynx. So those are the three types of the pharynx that we have. That's your throat. From the pharynx, you go to the larynx. That larynx, that's where you now have your epiglottis that covers the respiratory tract when you are eating to prevent food from entering. So you have the larynx. On top of the larynx, you have your epiglottis. The space in the larynx there is called the glottis. From the larynx, you will now go to the trachea. The larynx is called the voice box because it makes sound. Then from the larynx, on the diagram there, you see that whitish part. The whitish part that has like a gray round it is called the trachea. The trachea is the windpipe. The trachea extends downward, we now divide into two. One into the left lungs, one into the right lungs. Once the trachea divides into the right and left lungs, they will now become what they call bronchiole. From bronchiole, they will now become bronchioles. Those ones, they are just tiny, they are small air space. From there, you will now go to the least, which is the alveoli. That alveoli is the most important because it is in that alveoli that exchange of oxygen and carbon dioxide takes place. Exchange of oxygen and carbon dioxide takes place in the alveoli, and they are what? Tiny spaces. Once blood is coming from the heart, enters through the pulmonary vein, comes to the lungs. When it gets to the lungs, as it's passing by, it does not come to the lungs and stay there. As it's coming, it will be passing. As it's passing through this alveoli, you inhale air, oxygen will enter inside the blood, carbon dioxide will come out. That is how it is. It's a normal process and a normal mechanism. So the exchange of air between atmospheric air and the blood in your respiratory tract is called external respiration. Exchange of gas between the blood and atmospheric air in your lungs is external respiration. The exchange of carbon dioxide and oxygen in your tissue is called internal respiration. So if they say the exchange of oxygen and carbon dioxide in the tissue is called what? Internal respiration. The exchange of oxygen and carbon dioxide in your lungs is external respiration. And there's what they call upper airway and lower airway. Your nose, your mouth, your larynx, they are upper airway. From your trachea down to your alveoli is lower airway. That's why they will say upper respiratory tract infection, lower respiratory tract infection. So if they say upper respiratory tract infection, they're talking about the nose, talking about the pharynx, talking about the larynx. But when they say lower respiratory tract infection, they're talking about the trachea, the bronchioles, the alveoli, etc. Also, one important thing in this respiratory system is the diaphragm. The diaphragm is just a thin muscle. It helps during inhalation and during exhalation. So it's normal when you are breathing in and out. But when you are now doing forced breaths, you will now use accessory muscles like your rectus abdominis, your transverse abdominis. All those ones, they are muscles from your stomach, muscles from your intercostal muscle, from your sternum, all those ones there. When you are using those muscles, it means you are breathing with force. But naturally, it just be your intercostal muscle and your diaphragm when you are breathing normally. So we'll go to the questions now. Question 21. It said the primary site for gaseous exchange or gas exchange in the lungs. You see, they said in the lungs. If they say gaseous exchange in the tissue, you know it's internal they are talking about. But they say gaseous exchange in the lungs. So it's called B, alveoli. Alveoli, that is where gaseous exchange happens in the lungs. Number 22, they said the main function of respiratory system is to do what? Is to take in oxygen and take out carbon dioxide, because carbon dioxide is a waste. So it exhales carbon dioxide and inhale oxygen. So your answer is A, exchange oxygen and carbon dioxide. That's the main function of the respiratory system. Number 23, which finding is most suggestive of respiratory distress? When they say respiratory, you know when somebody is in distress, it means you are in discomfort. Respiratory distress means the person is finding it difficult to breathe. When you are finding it difficult to breathe, that's when you will now start using your accessory muscles. It's just like you are using assistant muscle, not the normal muscle that you are supposed to use. Like the diaphragm, that is a very flat, thin muscle that you use for normal respiration. When you are not using accessory muscles, you know that this person is having difficulty in breathing. That's why some people during cough, when they are having cough, etc., after coughing and then they are having kind of distress when they are breathing, when they get better, all the muscles of the abdomen will just be paining them. They'll just be feeling pain in their abdomen. Why? Because those muscles there have assisted in the breathing, forced or distress breathing. So most suggestive of respiratory distress is when you are using your accessory muscles for breathing. So the answer is A, use of accessory muscles. 24, a patient with acute dyspnea. Dyspnea is difficulty in breathing. Acute means it just came just like that. If it's chronic, it means that it takes time, maybe few months. Chronic means few months, something that takes time. It did not just come suddenly. It is not a sudden stuff. But acute means sudden. So when somebody is having dyspnea, the best position to put this patient is high Fowler's position. That's sitting upright, 60 to 90 degrees. It could be complete 90 degrees. It could be 60 degrees, but between 60 to 90 degrees is high Fowler's position. Anybody in dyspnea as a result of pulmonary congestion, pulmonary disorders, any disorder that is bringing about dyspnea, difficulty in breathing, once you put the patient in cardiac position or you say high Fowler's position, the patient's breathing pattern will be relieved. 25. Which oxygen device provides relative precise oxygen concentration? Relative precise oxygen concentration. It means it's giving you the exact oxygen you need. It's not giving you too much and it's not giving you less. Is Venturic marks. If you just browse and then see the different kinds of marks. This nasal cannula is the normal nasal cannula you put in the nose that has two small tube. It's nasal cannula. Simple face marks is just simple. It looks like Venturic marks, but the difference is that in Venturic marks, before you attach it to the tube, there is something that is attached to the marks before it is attached to the tube. That's just the difference between the simple face marks and these Venturic marks. Why these non-rebreather marks is like a marks that you connect to an ambo bag, but it's not really an ambo bag like that, but it looks like an ambo bag. That's the non-rebreather marks. Just browse and check the different kind of marks used for oxygen supply. Number 26. They say a common symptoms of pneumonia is pneumonia. You know, it's bacterial infection. Of course, there will be cough. Most disorders of the respiratory tract always comes with cough. There will be cough and there will be fever. Fever because it's bacterial infection. So it's A. Your answer is A. 27. Which finding may indicate inadequate oxygenation? When there is reduced oxygen in the body, that patient will become bluish. bluish coloration of the skin, of the eye, of other membrane is called cyanosis. Cyanosis means bluish coloration of the skin, of the conjunctiva of the eye, then other muscles too. It's cyanosis. That's reduced oxygen in the body. 28. A patient with pulmonary tuberculosis requires what? Is A, airborne precaution. You know, in our first video that we talked about infection prevention and practices, we talk about different precautions for the different diseases: contact precautions, protective precautions, airborne precautions, inhalation precautions, etc. For tuberculosis, we use airborne precaution. Airborne because it is carried through tiny it's like vapor. This tuberculosis, the mycobacterium tuberculosis, it goes with something like, it's like a vapor. It's not like droplets that you can see. They move like vapor. So anything that is like vapor is always airborne. So airborne precaution, you know, NSA airborne precaution has to do with you wearing masks, not staying in overcrowded area, etc. So airborne precaution is used for pulmonary tuberculosis patients. Question 29. A patient with pulmonary tuberculosis should be taught to A. Any patient with pulmonary tuberculosis, even all respiratory disorders that comes with coughing and the rest, and those diseases are communicable, the patient should be taught what they call respiratory hygiene. Respiratory hygiene: cover your mouth when you are coughing, cover your mouth when you are sneezing. If you don't have handkerchief to cover your mouth when you are coughing or when you are sneezing, you can use this side of your elbow to cough so that you can reduce the spread of those vapor that is coming out during coughing, during sneezing. It should be reduced. Because if you don't do that, you don't cover, as you cough out, you are spreading it. The hair will just carry it. You sneeze, the same thing, you just sneeze it out. That's why if you put yourself in a closed room, you sneeze, or cough, when you come outside and come in again, you see everywhere will be stuffy. Why? It will be filled with that bacteria in that place. So any patient with pulmonary tuberculosis or respiratory disorder that is communicable, they should be taught respiratory hygiene, how to cough and how to sneeze. 30. A common symptom of asthma is asthma. One of their common symptoms is wheezing. Wheezing is like a musical sound. You just, if you put your stethoscope on the patient's chest, you just be hearing it's like a music. It's very high pitched though. It's like a music. So patients with asthma, patients with COPD, that's chronic obstructive pulmonary disease, they do have wheezing as one of their common symptoms. Jaundice is yellowish coloration of the eye and the skin. Peripheral paralysis is paralysis. Then hematuria, that blood in your urine. So the answer is A, wheezing. Wheezing is common symptoms for asthma, common symptoms for COPD. 31. During an acute asthma attack, the priority is any respiratory attack. Your priority is A, B, C, D, E. A, B, C, D, E. A, airway. You must assess the airway, assess your breathing, assess circulation, any disability, and exposure. That is what you do in emergency cases. You must do your A, B, C, D, and E. So assess airway, assess breathing. That is what you should do. A bronchodilator is primarily used to do what? Bronchio, from the word bronchi, bronchulus. So you know that anything they say dilator, it means to dilate, it means to relax. Constrictor, it means to constrict. So bronchodilator is anything that will relax the bronchioles, will relax all those air space in your lungs. And when they are relaxed, they'll be able to take in more oxygen and take out carbon dioxide. So bronchodilators, like a normal Ventolin that you use during asthmatic attack, etc. So those are bronchodilators. So what they do is they help to relax the bronchi, the smooth muscles, and then they will improve airflow in and out of the lungs. That's what bronchodilators they do. There are different types of bronchodilators, but they all do the same thing. Relaxes the bronchi, makes you to breathe better. 33. Common feature of COPD. COPD, I told you before, common feature of COPD, of asthma, wheezing. Yes, there will still be difficulty in breathing, because from just the name COPD, that's chronic obstructive. When they say something is obstructive, means that thing is causing problem. It's obstructing you from doing the normal thing. So it's obstructing your normal air flow, obstructing your breathing. And anything that will obstruct your breathing must bring about dyspnea, difficulty in breathing. Because it's obstructing you from breathing, it means you have difficulty in breathing. So a common feature of COPD, chronic obstructive pulmonary disease, is A, chronic cough and dyspnea. Dyspnea must be there. You must have difficulty in breathing. Shortness of breath, you must have it. So that's your answer is A. 34. Pulse sleep breathing in COPD can help to do what? It's A. It helps to improve exhalation and reduce air trapped. Pulse sleep is when you inhale with your nose. You inhale for like 2 seconds. As you are inhaling, you close your mouth. So you inhale. You inhale with your nose. As you are inhaling, your mouth will be closed. And when you want to exhale, you will now exhale with your mouth. And you are exhaling with your mouth. It will not be as if you want to blow whistle. And you do it slowly. It helps to reduce any air that is trapped inside, because you're having difficulty in breathing. It means you cannot breathe in enough oxygen, and carbon dioxide are trapped inside of you. You cannot bring them out. But when you do this pulse sleep breathing, it's like a breathing exercise. When you do it, you'll be able to bring out more carbon dioxide from your body and breathe in more oxygen. As a result, you will not end up with cyanosis, because when oxygen is reduced in your body, you will end up with cyanosis. So pulse sleep breathing helps to improve expiration and helps to reduce trapped air in your lungs. Question 35. 35 says, which intervention helps prevent post-operative pulmonary complication? Post-operative pulmonary complication, they call it PPC. PPC, post-operative pulmonary complications. There are complications that can arise after you've operated on a patient. You operated on a patient, maybe on the respiratory tract, either upper or lower. After operation, what are the complications? One, pneumonia. Another one is respiratory failure. Another one can be pulmonary embolism. You know embolism. Embolism is clots of blood trapped either in your artery or in your vein. So they could be trapped clots. Sometimes it's even air that can be trapped. So those are the complications you can get during PPC, post-operative pulmonary complications. So they said intervention can help to prevent it. How do you prevent it? Is deep breathing exercise. That's why any patient that is going for any operation, they will tell you, as the peri-op nurse, the nurse that will teach this patient things to expect after the surgery. You should explain to the patient and teach them how to do deep breathing exercise. Teach them how to do deep breathing exercise. Teach them how they will start ambulating before the surgery. So those are things you do pre-operatively. Deep breathing exercise. Teach them how to cough, because after operation it's not easy to cough. As you are coughing, all those your muscles, the pain is there due to your incision. And how to move, that's early mobilization, that's ambulation. When they say ambulate is to move. So early mobilization, when you teach them these things, there will be reduced complication of any surgery, including pulmonary. So there will be reduced complication. So peri-op nurse teaching us deep breathing exercise, teaching us coughing, teaching us how to move or how to ambulate early. So your answer is A. Question 36. Incentive spirometry or spirometry. Incentive spirometry is primarily used to do what? The incentive spirometry is like just try and browse it. It's something you can hold. They say it's handheld device. It helps you to expand your lungs. There's a way I don't know how to explain it, but it's like a jar that has some fluid inside, clear water. Then it has calibrations. It also has something like that tube that you can put inside your mouth. I will not explain you know, the tube now that you can put inside your mouth, as if you're using it to inhale and to exhale. So that's how this incentive spirometry is. It's just something you can hold. They normally use it in respiratory disorders, or maybe you just came out from surgery, they want to help you to expand your lungs very well. So they'll just give it to you, you hold it and you put it in your mouth, you use it to do exercise. What it does is that it promotes deep breathing and helps prevent atelectasis. That is what it does. That is what it does rather. It promotes deep inspiration and helps to prevent atelectasis. 37 say a high-pitched musical respiratory sound. Once you hear high-pitched musical, no, it's wheezing. Crackles is different, rancors is different, pulmonary rub, they are all different sound. But one that is high-pitched musical is wheeze or wheezing. 38 stridor. They say stridor may indicate is an obstruction of upper airway. So the upper airway, nose, pharynx, larynx, those are the upper. From trachea down is lower. So obstruction of upper airway is stridor. Then your next question, they say during suctioning, just the way you suction baby, you also suction adults too, that are having secretions in their respiratory tract, even in their mouth, mostly unconscious patients in oxygen, etc., that are having some secretion. Secretion, it can actually be normal saliva, but it could be sputum, it could be cough, etc. What you do is that you suction it with your suction machine, and you use your NG tube, or you can even use the tube from the suction machine, depending on what you are trying to suction. So when they say a patient is suctioning, the nurse suctions the patient. Why are you suctioning this patient? That's why they say the priority. Why are you doing this? You are doing this, yes. Why are you doing it? Your rationale towards that intervention or towards that care that you are giving. Why is to maintain the airway. You want to maintain patent airway. That's why you are doing the suctioning. Maintain patent airway and to monitor oxygenation, because that sputum there can actually block the larynx and prevent air from entering into the trachea. There is a way saliva will gather in the throat of an unconscious patient. If it's conscious now, you can swallow it or you can spit it out. But if the patient is unconscious, the patient cannot swallow, cannot spit it out. So the mucus or sputum will just be trapped in the larynx there, or in the pharynx, they will just be trapped there. But when you suction it, you make that way become patent, and it will help to increase airflow and also increase oxygenation of the patient. So suctioning helps to maintain airway safety, maintain airway patency, and also to increase oxygenation. So your answer is A. Number 40, they say major health promotion measures for preventing chronic respiratory disease is what? In short, all diseases of the body. One of the preventive measures is to prevent smoking. Prevent smoking. Anything concerning respiratory, prevent smoking. Because anything that has to do with bad air, not just only prevent smoking and prevent staying in places where they are always burning things. All those places where they are always burning things, you should try and put on your face masks. Where they are burning bushes, where they are burning wastes, all those places that they do burn, always put on your mask. Even all those people that used to work in abattoirs, all those abattoirs that do smoke the animals, because some they remove the skin. All those places where there is smoke, bad smoke, you should try and avoid them. Avoid tobacco, avoid all the smokable things they are smoking. If you can avoid that, you will help your respiratory system in a very long way. So those are the questions we can take for now. There will be more questions by September or so. We'll have more questions on respiratory system. So follow us for more videos and subscribe to my YouTube channel. Thank you.